Good morning and welcome to the November 2024 episode of Insight here on BCTV. We'd like to welcome all of our viewers. We thank you so much for joining us. We'd also like to welcome our very special guest, Dr. Nemani from Eye Consultants of Pennsylvania. He is a board certified ophthalmologist specializing in glaucoma after having completed a 1-year fellowship at the Shea Eye Institute at the University of Pennsylvania, and he is also the vice president at Eye Consultants of Pennsylvania. My name is Mark Levengood. I'm the counselor at the Vision Resource Center in Berks County, and our topic for you today is glaucoma. So good morning, Dr. Nemani. How are you today?
Good morning, Mark. Thank you so much for having me.
Of course. Thank you for joining us and giving us part of your day. And if you could just start us off by sharing big picture, what is glaucoma?
Yeah, great question. So glaucoma is a term that's used to describe a group of diseases.
Mhm.
So not just one single disease, but a group of them, all sharing sort of the same common denominator, which is damage to the optic nerve, the cable that connects the eye to the brain,
Mhm.
um, typically caused by pressure inside the eye being too high.
Okay.
So um, the average pressure inside the eye is usually between 10 and 20 millimeters mercury.
Mhm.
And for some folks, having pressures double, triple that is what can lead to glaucoma, where the optic nerve undergoes atrophy or weakening from the pressure.
Okay. And what causes it to happen?
Yeah, so glaucoma comes in a lot of varieties. There's glaucoma that I describe to a lot of folks, like many of my patients, I'll tell them kind of vanilla chocolate form of glaucoma. The very garden variety, average glaucoma, is typically caused by just natural processes getting older. The
Okay.
aging process of the eye um, essentially causes the pressure in the eye to build. For some folks, the drainage channel that accepts pressure
Mhm.
fails to work over time, and then pressures rise in the eye and cause nerve damage. So
Mhm.
the most common form of glaucoma, typically what affects folks, the average population, is this type of glaucoma where uh, no specific cause, but aging itself is the
Mhm.
cause.
Sure.
Then there are a few other varieties of glaucomas that are caused by something else. For
Mhm.
example, very uncontrolled diabetes
Uh,
could lead to changes in the eye from blood vessels, and that could be a cause for glaucoma.
mhm.
Um, some people might have an eye condition called uveitis,
Mhm.
which is an inflammatory condition of the eye, and that can lead to glaucoma.
Mhm.
And just, the last example I'd give um, would be, for example, certain medications. Someone could
Mhm.
be on a long-term medication, like a steroid, prednisone, taking it for a long time, and that itself could cause glaucoma.
Sure. Yeah. Now, with all those different varieties and causes, roughly speaking, how long have we known about glaucoma?
Yeah, so glaucoma has been known about, for centuries. Since ancient times, this disease in some fashion has presented itself to, the beginnings of life.
Okay.
There are lots of anecdotal and historical um, accounts of civilizations and physicians being aware of glaucoma.
Mhm.
Um, Typically, because intraocular pressure reading or measuring the pressure in the eye was not precise in those times, this
Mhm.
was something that was typically uh, determined by feeling the eye and
Okay.
feeling how hard or soft it was,
Sure.
and that's how a lot of glaucoma was diagnosed at that time, and also just the physical changes to the eye from having high pressure. For example, the eye becoming and looking cloudy,
Hmm.
which is something that, physicians today would not see because glaucoma is typically treated well before something like that could happen.
Hmm.
But that's definitely been described since ancient times, um, in ancient Greece, and sometimes even the term glaucoma kind of has this origin from the bluish gray clouding of the cornea that would happen. I think glaucos in ancient Greece meant, blue gray, and that referred to the color that
Hmm.
the eye would take from this cloudiness that would happen from the disease process going untreated.
Okay, sure. And speaking of the disease process, could you explain the disease process for glaucoma for us?
Yeah, sure. So, just focusing on sort of the most common form of glaucoma first, the glaucoma that probably affects the majority of people out there. This is a process where inside the eye, the natural drainage channel. This is a structure that lives inside the eye. It's sort of between the iris and the cornea. So
Hmm.
kind of inside the eye in a special area, it's a 360 degrees kind of circumferential structure in the eye. So it goes all the way around. And this is what is accepting the fluid called aqueous
Hmm.
inside the eye and letting it release out of the eye. The eye has its own circulation pattern, and this aqueous fluid, which is produced on a continuous basis, microliters per minute,
Hmm.
this fluid needs to leave the eye, and it leaves the eye via this channel. In folks who get the most common form of glaucoma related to aging, what happens is that that channel has some resistance to it over time. There are
Okay.
some areas within that channel that stop doing its function.
Hmm.
So the ability of fluid to pass through that channel diminishes over time.
Hmm.
So the production of the fluid inside the eye called aqueous is typically a constant, but the ability of that fluid to exit the eye is diminished in folks who have glaucoma as the channel or the drain, if you will, sort of loses its ability to accept flow of fluid.
Sure.
A way to kind of conceptually think of it,
Hmm.
imagine like a sink, and inside the sink, the faucet is running continuously at a slow pace, let's say.
Right.
But and for your whole life, the drain keeps up with that pace. The drain in
Hmm.
the bottom of the sink is continuously taking that fluid and letting it go down.
Hmm.
And imagine over, 50 years, 60 years, 70 years, that drain, even though the flow has been constant, the drain's ability to keep up with the drainage or the flow down through that pipe has weakened over time and diminished.
Okay. Yeah, it's like clogged. Yeah.
Clogged, exactly.
Yeah. Okay. So I know you said there are a number of different forms of glaucoma, but it seems like most of them are associated with high pressure. Are is there ever an occasion where you have low pressure glaucoma? And what would trigger that? And is one more serious than the other, low versus high pressure?
Yeah, that's a great question. And a difficult question for a lot of people to wrap their head around, especially patients. Um,
Yeah.
this 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 brings up a very specific form of glaucoma that exists called normal tension glaucoma or low tension glaucoma, and tension being a word used in medicine to describe the same thing as pressure.
Hmm.
Um, so low pressure glaucoma or normal pressure glaucoma describes a type of glaucoma that exists or that can occur where inside the eye, the
Hmm.
pressure is actually relatively normal. Not high by any means,
Hmm.
within the normal ranges, as I mentioned earlier, between 10 and 15 millimeters mercury, certainly less than 20 millimeters mercury. And this describes a glaucoma that I wouldn't necessarily call rare, but definitely not the most common form.
Right.
Um, I will often tell patients, to help them understand, where this glaucoma exists on the spectrum. I'll often say to them, it's the mint chocolate chip variety of glaucoma. So not chocolate, not strawberry, not vanilla, but not a glaucoma no one's ever heard of.
Sure.
So it helps patients know that, this is not a type of glaucoma they're going to need to travel hundreds of miles to see,
Hmm.
a super specialist who doesn't, maybe in New York City
Hmm.
or Boston or Philadelphia. But instead, it's a glaucoma that isn't the most common that we will encounter in the day, but
Hmm.
certainly other people who will come and see us that same day will have, that same variety. So it gives them that little bit of comfort in knowing that they're not completely dealing with something unusual
Right.
or extremely rare.
Yeah. So, what are some of the precursors and warning signs that, as an eye doctor, you would look for, or even as people go about their day to day, things that they might see in their field of vision, those precursor warning signs that might indicate glaucoma is developing?
Yeah, so glaucoma largely remains a disease, and in most of its forms, like the most common as we've so far discussed, it remains a disease that has very few or no warning signs.
Okay.
Um, a common sort of description of glaucoma is that it's the sneak thief of sight. It's this disease that exists where a patient may not have or typically does not have any awareness that they have this disease.
Uh,
Um, Folks who may experience vision loss from glaucoma in its early stages, as in a warning sign,
mhm.
those signs can be very, very difficult for someone to appreciate
Mm,
because they are oftentimes more peripheral, far away from the center part of vision, where it's
mhm,
less detectable. And also, with two eyes open and two eyes functioning, it's easy for the brain to adjust and sort of uh, be less aware of a defect that may be occurring that really can only be recognized in the doctor's office.
Okay. Yeah.
Um, which kind of segues to what you said next, which was how would a doctor know, or how would a doctor first be able to tell?
Hmm.
Um, and to answer that part of the question, physicians, whether they're optometrists or ophthalmologists, will do some screening tests for glaucoma, typically checking intraocular pressure, which catches a lot of folks who might have just right off the bat high pressure glaucoma.
Hmm.
But beyond that, the clinician will often do an examination of the optic nerve
Hmm.
inside the eye, which can give clues too. So
Okay.
not
Yeah.
something the patient can tell, but the examiner can see when looking inside the eye. The optic nerve
Right.
has features to it, a color to it, a shape to it, a size to it, and those judgments can be what first kind of give the impression that there could be glaucoma happening.
Sure. Yeah, because the pressure is going to change the color, the shape, everything, the size. Yeah. So that makes
That's
sense.
right.
Yeah. So, for once someone has been diagnosed, what are the symptoms that they're going to experience moving forward, and what's their field of vision like? How does their field of vision change as glaucoma develops?
Yeah. So, um, untreated glaucoma, in someone who has the disease, chronically long-standing, many of them can lose significant portions of their peripheral vision,
Mhm.
really diminishing how much peripheral vision they have, we typically see folks lose outer edges of their
Mhm.
vision, in the far periphery first, and
Right.
then central vision is typically spared till the end of the disease or toward the later stages of the disease.
Mhm.
So, untreated glaucoma, the progression is sort of one of which it generally starts off undetectable, unnoticeable to an individual, but could, if untreated and unchecked, could all the way kind of lead to disability, to a point where driving a car could become difficult or
Mhm.
impossible.
Yeah.
Um, I would say that the rate of progression most commonly in glaucoma is one of more of a slower process.
Mhm.
Um, the disease does not move as fast as, let's say, retinal detachment.
Okay.
Somebody
Yeah.
might right away lose their vision to something like that.
Mhm.
Glaucoma doesn't typically, in its most common forms, cause acute vision loss.
Okay. So
Um,
it probably would not lead to total blindness if left untreated.
if left untreated, most common forms of the disease are not going to lead to complete blindness.
Mhm.
But again, you know, untreated glaucoma for decades and decades, by
Mhm.
the time someone's, you know, in their 80s and 90s, certainly the idea of them having legal blindness or severe impairment can
Mhm.
certainly. Um, but fortunately, we practice in a developed country where there's a lot of access to intervening on the disease before that happens.
Yeah. Now, is glaucoma found in a specific age bracket, or can it pretty much be diagnosed from children on up through seniors?
Yeah, also good question. So yeah, people can be born with glaucoma. There is a
Okay.
congenital form of the disease.
Mhm.
Um, Fairly rare disease, in infancy and childhood. Congenital glaucoma, not something that, is certainly commonplace. And the disease can exist in, juveniles, young adults, but the majority of folks who have glaucoma tend to be folks who are, in the senior age
Mhm.
group or bracket. 55 plus is a time when I think the risk for glaucoma typically, becomes more rises quite a bit.
Sure.
Uh, but yeah, certainly childhood glaucomas exist and adolescent glaucomas exist. The glaucomas that exist in the younger population, whether it be congenital uh, children or young adults, typically those glaucomas are caused by something else. So
Right.
some other factor. For kids, oftentimes it can be uveitis.
Mhm.
So inflammation in the eye, which leads to scarring of the drainage channel. So that same
Right.
part of the eye that we talked about. Uh, Uveitis is a condition that can affect children, which can go on and cause glaucoma.
Mhm.
Um, some developmental abnormalities of the eye, developmental abnormalities of the drainage channel. Those are what we call secondary glaucomas, meaning that they're caused by something else. Whereas um, adults and elderly folks will get what we call primary glaucoma, which
Mhm.
is glaucoma just caused by aging and because of itself, the drain becoming over time affected.
Sure. Yeah. Now, what is the how prevalent is glaucoma, both in the United States and across the world?
Yeah, so glaucoma is a disease that is increasingly more prevalent in the developed countries as well as undeveloped countries. So worldwide, it's one of the most prevalent causes of loss of vision. It is one of the most prevalent eye diseases. So certainly a big problem worldwide and a big problem nationwide. And as the kind of baby boomer population ages, we see, a lot of folks in that age group that are affected or at risk.
Hmm.
Certainly not a rare disease by any means,
Right.
um, and one that deserves fairly careful screening for,
Right.
especially as we cross into those ages.
Hmm. Now, is glaucoma becoming more frequent as people are living longer, or have all the development in medical science and technology in the world of optometry and ophthalmology helped to slow or even, just maintain the frequency of it?
Yeah, so one of the things we often say to patients that a lot of times patients will say, well, what did I do something wrong, or how did I get glaucoma? Did I did I eat the wrong things? Did I
Right.
was it a diet thing? Was it did I not exercise enough? Is it stress related? Is it too much something that they did? And what I'll often tell patients who may have that concern is number one, no, this was not something that they brought upon themselves, but essentially that this is something that almost all of us, if we lived long enough, would in our lifetime get.
Hmm.
Uh, it's one of those things that, you and I both are, gonna start to have more and more gray hairs, whether in our beard or our our scalp, we're
Right.
gonna all eventually lose our hair. If we all could get to 110 or 120 years of age, there won't be very many of us who have hair in our head anymore.
Right.
It's sort of the nature of how the body ages, and
Hmm.
and that's what I'll often tell some of these patients. I'll say, boy, if all of us lived to 120 or 130, we'd all have glaucoma
Hmm.
by that age. Our
Right.
natural drainage channel over that many years
Hmm.
will give out. It just
Sure.
doesn't have, the tread life to get to, an infinite amount of time.
Hmm.
So it's a way for patients to help understand that the disease is sort of in your genetic makeup.
Right.
It's in your protoplasm. It's in your DNA. It's just a matter of when is it going to come and express itself. And
Sure.
then unfortunately, there's a lot of folks out there who have expression of that genetic sort of predisposition much sooner in life. So not getting it at age 120, but getting it at
Hmm.
60 or
Sure.
70.
Hmm.
And so that's the care for glaucoma is essentially about trying to help those individuals so that they
Yeah.
can get, the fullest amount of vision their whole entire life.
Hmm.
But
Hmm.
yeah, that's what I think that sort of helps people know that there wasn't something you did. It's just by
Right.
nature of our design.
Exactly. Yep. Well, in just the few minutes we have left, could you share with us any information regarding treatment methods? Is there a cure for glaucoma that would ultimately restore vision, or what's out there on the market for treatment?
Yeah, yeah. So, great question. When we talk about treating glaucoma, um, we are looking to lower the intraocular pressure for patients, and that includes patients who have high pressure glaucoma and patients who have low pressure glaucoma. We
Hmm.
are essentially trying to bring the pressure down lower than where it started,
Right.
where we first noticed that there was trouble to the eye. Um, how we do that, are the different ways, that currently exist. Those ways and methods typically are come in a few ways.
Hmm.
One one way to bring pressure down inside the eye is pharmacologically or with medication.
Right.
So this typically means eye drops. So eye drops that help lower pressure inside the eye, which typically work by going back to that sink analogy,
Hmm.
either turning the faucet down, so making less aqueous inside the eye, so the fluid
Hmm.
production can be slowed or turned down a bit,
Right.
or working on the drain side, helping the drain be more leaky and getting fluid out the drain more easily. And I will sometimes, as a way to help patients understand that more, I kind of give them this analogy that it's sort of like, and I hate using the word, but it's sort of like Drano. You're helping your eye work better by helping the drain in your eye just work better inside.
Right.
Obviously, the eye drops are not Drano, but they're sort of to help patients understand that mechanism. There's ones that just turn the faucet down, and there's ones that
Hmm.
help them make the drain just go out so more easily.
Right.
Um, and I would say, for the large part, glaucoma medications, eye drops are the mainstay of therapy
Hmm.
for the disease. There are other alternatives to medication, eye drops. For example, ophthalmologists have access to laser therapy for
Hmm.
patients. They can offer laser as a way to treat glaucoma, which is not surgery, but a procedure that's typically done in a office setting or office-like setting
Hmm.
that helps the brain inside the eye work better. Um, and then for cases where, eye drops or laser therapy, sort of easier and initial options are not as effective or working, there are surgical options for patients.
Right. Sure. Okay. So as we begin to close, if anyone actually does have glaucoma and they're interested in working with you and consulting with you to hopefully improve quality of life, what could they do to get an appointment with you and explore their situation further under your guidance and your care?
Sure. Yeah, so we see patients, or I see patients along with a couple of my partners who are glaucoma specialists at Eye Consultants of Pennsylvania. We have locations throughout Berks County. We have locations outside of Berks County too, just on the neighboring counties.
Hmm.
Our phone number, I can share it with you if you'd like.
Sure.
Um, it's 610-378-1344, and we will happily look to make an appointment to schedule and evaluate people for glaucoma, whether they are, concerned about the disease and need just some clarification whether they have it or not. And
Hmm.
then for those who have glaucoma and need care for it, we certainly can assist in that too.
Sure. Okay. And then just one last question, big picture. If anyone is interested just in learning more about it, where can people go to learn more about glaucoma?
Yeah, that's a good question too. So there's a lot of good resources on the web. I think that's probably the most user-friendly place to look for quality information. And I think the American Glaucoma Society would be a good starting point. That's the sort of governing body of glaucoma specialists.
Hmm.
And there's a lot of patient resources, a lot of handouts and things on their own website that could help. um, and then the American Academy of Ophthalmology, AAO, is also a plethora of resources for folks who want to get started with initial information. And then, those are probably the two most trusted sites for from eye care professionals that I can certainly, you sanction. And I think beyond that, within those two websites, there's a lot of variety of links for people to
Right.
explore, where they can find more patient-centric information as well.
Okay. Sounds great. Well, Dr. Nemani, thank you so much for joining us. We really appreciate your shedding light on this, as you said, a very common eye condition that a lot of people struggle with. And if we all live long enough, we'd all eventually get there. And so I think it's good to learn more. So thank you for coming on the show and helping to educate us on this important topic.
Oh, my pleasure, Mark. Thank you.
Yep. Yep. We appreciate your expertise.